Thank you. Thanks for having me. I'm one of the anesthesiologists and pain physicians here. I also manage the training program for pain physicians at Mount Sinai. It's really a huge issue, and the scope can't really be easily summarized. But what I want to do is, essentially through articles that are only found in the New York Times, is sort of frame the issue in about 5 minutes. One of the challenges that we have is really managing opioids in pain patients. A little while ago, maybe 15, 20 years, some well-intentioned individuals really opened the floodgates for the use of opioids in essentially unlimited amounts for all types of pain. And what we've been finding is that that's problematic. It's problematic on two sides, really. The first side is that the efficacy of these medications is much more limited than previously believed. And on the other side is that the risk of these medications in the short term and in the long term is also much greater than previously believed. And so here we have sort of this, the setup that, physicians really started prescribing a lot of opioid medications and really created sort of really a crisis in the country as far as opioid misuse, opioid overuse. And when the opioids now really started coming off the market, that really transitioned into the modern day heroin epidemic that is prevalent everywhere, but really especially in the Northeast. These are all from the New York Times. So then people started noticing that not only are the medications not working, but a lot of people are dying in relation to the use of these medications. Now, if you look at, this actually is coming out better on the screen. If you look at the total number of deaths from opioids, and this is not including heroin, this is prescription opioids, it's really essentially, it's like the Pac-Man that swallows, all the American casualties in every war fought since World War II. When we think about global impact of things like Ebola globally, in the course of the last epidemic, killed about 13,000 people. During the same year, 18,000 people died just in the United States, secondary to prescription opioid overdoses. This is a huge public health issue. So recently, there's really been a move to limit the amount of definitely inappropriate opioid prescribing, but really to limit the amount of opioid prescribing and to focus on alternative strategies for the management of pain. And this happened on the state level, this happened on the federal level, and recently CDC's come out with some new interesting guidelines really aimed at primary care physicians, but it's really permeating the practice of medicine. New York State just passed laws limiting the amount of medication that can be prescribed, opioid medication that can be prescribed for acute pain. So the problem is, what other technologies, what other medications do we have for the treatment? And we have plenty of other things. The issue becomes, once we do have other things, some novel technologies that are coming in the market that one of my colleagues will discuss, how do we assess the effectiveness of these, interventions? We have some standard batteries, some standard questionnaires, we have pain scores, but really, can we have some objective measurements of function? And that's what really our payers are looking for assessment. And so this is an easy way to use wearable technology to assess function after pain interventions, to assess the efficacy of non-opioid pain medications, to use apps to somehow intervene on the patient experience of their pain. And so this is where I think there's really fertile ground for development. Thank you.